Welcome to the Royal Aberdeen Children's Hospital.
Good evening, Children's A&E.
Where every year more than 20,000 boys and girls from across the north of Scotland receive life-changing treatments.
We're going to take his appendix out.
There are tears and transformations.
You can have babies who are impossible to examine, you can have grumpy teenagers who just don't want to be here.
There is laughter.
Right, we're going to put it over here.
And moving moments. There is specialist care.
Yes, you are. You do really well.
Thank you, bud. You did really well.
And cuddles.
If in a day I've made a difference to one child, then that's great. I'm going home happy.
This is the Children's Hospital. It's a cold December day and the hospital is filling up. The morning shift at the Children's Hospital starts early and clinical nurse manager Julie is already on duty.
It is 7:20 in the morning. We start our early shift at 7 o'clock in the morning. Today is December the 6th and we are really busy. Our HDU unit is full to capacity +1. Today is our busiest operating day. So we have a little bit of juggling to do this morning because somebody requires an HDU bed and we are already at capacity.
Hello, HDU staff nurse.
There's an elective major surgery case scheduled today. But Julie has to decide first if there are enough staff and beds on the busy Highdependency Unit, or HDU. At the morning meeting, senior staff discuss patient numbers.
Who are you?
4 patients. 1 who probably could go to medical today, and 3 home in the morning.
HDU.
We are over capacity at 5 patients, and we are also expecting the Major General this afternoon because they're earmarked for a funeral. In terms of movement, it's all a little bit up in the air. So at the moment I can't guarantee any movements, but I will certainly be pushing for it.
Yeah, okay, well, if there's not movement, then we're not going to be able to do that general case.
If they can't free up some space in the Highdependency Unit, Julie will have to cancel the operation.
So we're giving ourselves no capacity for anything going pear-shaped, which...
It just takes one other sick patient to come in and that's us.
Yeah.
Yeah.
Waiting on the surgical ward is 10-year-old Ava. She's due to have major surgery. And it's her operation which might be cancelled this morning if Julie doesn't find a bed.
Ava is here for revision of Mitrofanoff and a bladder augmentation. We were told by Mr. Driver first thing that although Ava had a high dependency bed booked, there was an emergency came in last night and there wasn't a bed available for her, and because she will be having an epidural they need her to go to high dependency, and that he wasn't willing to do the operation without an epidural, and that we had to just wait until later this morning to make sure that the people that were due to move out of high dependency were still going to be moving out.
We're looking forward to having Christmas and Ava's birthdays in January as well, so we're looking at and almost using that as a get this over with, friends and family will come up, and then we'll look towards Christmas as the big picture.
There are currently 5 patients on the Highdependency Unit, which only has a capacity for 4 patients. So unless Julie can move other patients around, Ava's operation will be cancelled.
Oh, it's so disappointing, and especially such a large operation. It doesn't matter any time of year, but this time of year, parents, patient will be thinking this will be done before Christmas, we'll be home, we'll be able to recuperate, and to put all those plans and that anxiety that they're coming in with on hold again. Nobody wants to do it, that's why we will run around this morning and really try not, if anything can be done not to cancel this patient, we will be doing it. Hi Naveed, it's Julie, how are you? Hello. Yeah. It's 9:15. Just now we need a decision by 10 o'clock.
Yeah, that's what we were just discussing.
Julie finally secures Ava a bed in the Highdependency Unit.
all the bits of the jigsaw come together.
But she still needs to find more staff to look after everyone before Ava's operation can go ahead.
But we need to decide by 10 o'clock. It's 9:35, so we've got another 25 minutes to make the decision whether we can staff overnight and tomorrow if we have 5 patients in HDU. I need help.
Down on the high dependency unit, Harrison is also waiting to go into theatre.
This is Harrison, he's 15 months, and on Saturday morning he decided to pull a full, freshly made cup of coffee on himself, bless him.
I took him out his high chair because he was screaming, and within seconds he'd gone to get my cup, and it was like slow motion, no, stop, but it was just too late.
In the UK, it's estimated that on average 110 children per day are seen in emergency departments with burn injuries, 46 as a result of a tea or coffee spill.
It's just caught under his chin, and then the main bulk of it went on the top of his shoulder, a little bit onto his chest, and then it's gone down his right arm, but basically it's peeled the skin off his shoulder and down his arm. It was such a shock to see the damage that just one cup of coffee can do, one lapse of moment can do.
After being treated for his burns 2 days ago, Harrison developed a dangerously high temperature and was brought into the Children's Hospital with suspected sepsis. Sepsis is caused by Harrison's immune system working overtime to fight an infection, and it can be life-threatening.
So he's come to HDU at the risk of toxic shock syndrome. So when you've got a burn, the risk is of bacteria kind of going into the burn and releasing toxins, and then that's an infection then into the blood.
I know, you're trying so hard to get this foot away from me. So you put it on that way.
Like that?
Yeah.
The high dependency unit is for people who need more intensive observation, treatment and nursing. But Harrison isn't a fan of getting his obs done.
Are we going to let this happen? If he's getting too upset, then I'll just leave it. Right. I know. Oh no.
But he's more than happy for Nurse Laura to change his dressing. She uses cling film to keep the wounds clean and prevent them from drying out.
Clever boy.
Well done. Good lad.
Is that it? All done?
Say thank you.
Oh.
I think you've perfected that noise now, as soon as anyone comes in.
Harrison will be going to theatre to have his wounds cleaned in order to prevent the spread of further infection.
That's Peter's phone, so that's them ready for him. Okay. Yeah.
Okay, doke.
Ready? Remember, going on an adventure.
Harrison will be treated today by consultant plastic surgeon Mr. Kernier.
It's not really surgery, we're not using any sharp instruments here. It's more like an examination under anaesthesia and a clean with a brush and cleaning solution. So we're talking about minutes, I'm hoping 20 minutes.
Mr. Kernier is cleaning Harrison's burns to remove dead skin and bacteria from the wounds. This will reduce the risks of further infection and sepsis.
As we know from last night, this young man, he had a temperature of about 40 degrees, so he had a septic episode. So we're basically trying to tidy everything up, that there's no more medium for bacteria to grow in. We don't think it's coming from anywhere else. We don't think it's coming from his chest or his waterworks, whatever. And this is us removing all other sources and replacing it. We're really just relying on decontaminating the wound. Thank you, everybody. The surgical procedure is finished. The wound is scrubbed and dressed. We will watch this young man for the next 48 hours. He's had a significant septic episode. He seems to be getting better in spite of what we're doing in many ways. We've only just done the wound scrub. So we'll keep a close eye on him for the next 2 days, and if he's eating okay and he's wetting nappies and his dressings are manageable, he'll almost certainly get home.
He's got the cutest snort.
After his procedure, Harrison is reunited with a very relieved mum in recovery.
Hello, sweetheart.
Who's that? You can open your eyes and see Mummy.
Harrison, it's Mummy.
Harrison's just arrived back from theatre. We'll continue monitoring his observations, continue giving him IV antibiotics, and just monitor him overnight, give him pain relief if he needs it. But he's fast asleep now, so we'll just see how he goes.
Along on the surgical ward, Ava and her mum and dad are nervously waiting for news on her operation.
She's had a lot of operations, so kind of we stopped counting when we got into the 20s. Not all of them have been big operations. Often it's just a quick trip to theatre, but yeah, she's had 3 or 4 kind of big operations. This will be a 4th, I think.
Clinical nurse manager Julie has had a busy morning trying to ensure Ava's bladder operation will happen today.
Hopefully they will not know the running around that is going on this morning, because we do not need to add to the anxiety that they have just now.
You've got another deadline today.
I have got another deadline. It's my son's nativity play. And I've missed the last 2, so I was really hoping to get today, but we'll see. Hi Bruce, how are you? Okay, I'm just waiting for neonatal unit to get back to me whether they can support tonight, and if they can support us, I'm looking at saying yes to doing our elective case. Okay, so that's brilliant. Can you give me a call back? That'd be great. Thank you. Bye-bye. We're going to go for it and go and tell the surgeon and anaesthetist to go ahead with this case.
Julie gets her breakthrough as the Highdependency Unit confirms they've managed to staff the busy ward. She goes to tell anaesthetist Graham the good news.
Okay, we're good to go.
Okay, excellent. Okay, I'll go and get the pre-med sorted out for Ava then. And then we'll get her down in about 20 minutes time.
Okay, fantastic. Brilliant.
That's great. That's come together really well.
Yes.
Good. Ava, how are you? Good. So you know we were in this morning, we were discussing whether you get your operation today or not. The good news is we're going go ahead. Yeah? Yes, exactly. So we're hoping to get you down to theatre in about 20 minutes. So as we said before, we need a high dependency bed. We've got the high dependency bed, so we're going to go ahead. All right. Any questions at all? Happy? Okay, super. I will see you downstairs. You'll take the pre-med for me, won't you? Deal? Shake on it? It's a deal. Okay, all right. I'll see you soon. Okay, see you soon.
Say bye to Daddy. You're super brave girl, aren't you? That's it. You ready to go?
Ava has had a pre-med to make her sleepy before saying goodbye and finally heading down to theatre.
So everything has worked out really, really well. So I am now getting the opportunity to go and see my son in his nativity play.
It's like, how's your shift been?
Really, really quick. Really quick. It feels like I just got here 5 minutes ago, but very satisfying. Very satisfying.
See you later.
Bye-bye.
Okay, that's her off to sleep. Hang on, first. Give her a kiss. There's your chance. Excellent. You look
Well
after her.
done, Mummy.
Well
Thank
done.
you. See you soon.
It is estimated around 1 in 500 children in the UK will be diagnosed with cancer by age 14. On the medical ward, senior staff nurse Lewis helps to look after some of these patients.
I've worked in this ward for just over a year and a half. I started in May 2017. I used to work in the Highdependency Unit before, so it was a big change coming up here from a place where I only had maximum of 4 patients to a 25-bedded unit, so it was a big change. When I was younger, I knew I always wanted to do something with children, but I went through different things, like I wanted to be a primary school teacher, I wanted to do social work, and then I don't know why I applied for nursing. I just kind of thought, well, actually, I've never really thought about that, but actually I would never change it for the world. I love it, and I can't imagine myself doing anything else. So Davy is a 7-year-old boy with Burkitt's lymphoma, which is a type of cancer. So today he will be getting one of his last chemotherapies, which will be the end of his treatment. So it's quite a big day for him.
I don't feel like cardboard.
7-year-old Davy from Shetland was diagnosed 5 months ago. Since then, he's been staying in Aberdeen while undergoing chemotherapy. His siblings and cousins have come down from Shetland to celebrate the end of his treatment.
Barbs in its fur and the horn on its head are extremely poisonous.
Hey, wait. Okay, who's gonna come to the secretary?
Davy's chemotherapy is administered through injections into his leg, which he really doesn't like at all. But he's been given a device to distract him while he gets the injection.
I'm going to get his injection here, so what I would normally do is put it here. So it's just like a different sensation, so when he's getting this injection then it sort of distracts him. Why is he... Stop.
When the device is switched on, it vibrates, causing a tingling sensation which can reduce pain signals going to the brain. While Davy's attention is on the distraction device, Lewis preps his chemotherapy.
What we have here is cytarabine, 44 milligrams in 2.2 mils, and it expires 8 AM on the 23rd of October. Just change my gloves over. So the purple gloves are slightly thicker and they're longer in the arms because when we do chemotherapy with the cytotoxic risks, it protects us from the spillages. Thank you. Happy? Here we go, Davy. So we're going to do the injection, okay, Davy?
The camera crew step back to give Davy some privacy while having his chemo. But it only takes a few minutes.
All done. He was really good. He took a wee while to let me do the injection, but once it was in, he said I didn't feel a thing. The worst bit for him is when you take it out, he finds that a little bit painful. However, he wants me to do it again tonight, although I'm not here.
This does not have a spike on its head.
I was going to tell him it was a countdown to his last one, so I just said, I think this is only the last one, the second last one that you need to have, and then that's it.
Bird Pokemon. Pidgeot.
Yeah.
You would! No, I think you eat it.
He'll get his last chemotherapy tonight about 10 o'clock, and then that'll be his chemotherapy finished, and then on Monday he'll be on the ward for his end of treatment ringing of the bell.
While Lewis has been working at the Children's Hospital for 4 years, some of the staff are only just starting out. In the physiotherapy department, new recruit Nina is still finding her way.
I'm new in the job. This is my second week here, so I don't know where everything goes yet. So just having a rummage.
Today, she's preparing to meet a 13-year-old gymnast recovering from a broken arm.
I wonder if there's any games, because he's a hand patient, so if we can use some games for dexterity work. So I'll see what's... I'm a bit unfamiliar with all of this. So I don't think a 13-year-old boy will appreciate a Hello Kitty jigsaw, so we won't use that. See if there's any marbles in here, because they might be good. So some of these things might be quite good. So in here we've got a variety of different things like juggling balls, bean bags. I might try a few things because I'm expecting him to have weaker grip, just because he's had an injury to the nerve in his hand. Lewis, would you like to come through? We're just through here. He was doing a front flip or back flip, I'm not sure, on the trampoline in July, and he broke 2 of the bones in his arm, in his forearm, and due to the fracture he's also had a bit of an injury to the nerve that supplies, or one of the nerves that supplies the hand, so he's got a bit of weakness in his hand. He needs to come in for hand rehab really. From the information I've got, you had a fracture to both the bones in your arm, and that was because you did, was it a front flip or a back flip on the trampoline?
Back.
A back flip. And it went wrong?
Yeah.
Okay. And that was back in July?
Yeah.
Yes.
I did a backflip on a trampoline, and when I put both my hands down, I think I went over my shoulder, and then I put way too much pressure on this arm and snapped both the bones in half. I knew it instantly. I was holding it like that. Yeah, I just broke my arm.
It was horrific. So we got a phone call. He was training, and we got a phone call to say, come immediately. We've had to call an ambulance. He's had a really bad break to his arm. So I never took that photos that you see of the x-ray in the bone. That was actually the nurse, because I couldn't look at it when he first did it. So she had said that she would go and take a picture because she thought that that would be something he would like to reference once he was healed.
How do you think it's moving? Alright, I think it's moving well? Okay, yeah. So can you put this hand up on here for me, okay? Can you put your hand like this for me, okay? How much movement have you got bending the wrist back that way? That's pretty good, isn't it? Yeah. So we can measure it, but it looks like it's normal movement. 70, good. And if you were
3 months after his accident, Lewis's broken bones have healed, but he's still suffering from restricted movement and weakness to his hand.
Feels normal, okay. Yeah. I'm just gonna have a wee look at that one. So you relax your shoulder for me, and then I'm just gonna bring it round. Good, how does that feel?
All right.
Okay, so when I move your wrist, we get full movement, and when you try and move it, we've got a wee bit less, so what that means is it's the muscle that does that movement that's maybe a little bit weak, but we've got full movement at the joint, so the bones are moving fine. Yeah. So we need to work on a little bit of strength work there. Probably pop both up there.
Nina is going to run Lewis through some strengthening exercises to help build up his muscles and improve function while his nerve heals.
Does it feel numb, or does it feel more sensitive?
It feels quite numb and fuzzy.
Good. So you're going to push towards the wall, and then you're going to push back from the wall. And that's just going to take a little bit more body weight and get these muscles around your shoulder working as well. But the more you try and do that, the stronger the signal will be from the nerve. So if you've got a tennis ball at home, that's going to be a lot harder. Good, and then just practice putting it down. And it'll probably feel really easy.
So now we're just left with the question, is his nerve going to recover fully? The consultant said the ulnar nerve runs from your neck to the tip of your finger, so it's just these 2 fingers that are damaged, and they've kind of gave him 6 months, and fingers crossed.
So I'm going to put 2 fingers here. Can you squeeze my hand as hard as you can? Squeeze, 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 squeeze. Good. Are you making an effort? Because you're right-handed, we just need to build that strength up. Okay.
Now he's been shown the exercises, Lewis will have to commit to practicing them at home every day to speed up his recovery.
He's fantastic. He's really good. If he gets a job, he'll do it. And he knows himself. He wants to recover. He's competitive with his gymnastics, so he's off duty right now. He's missing a few competitions towards the end of this year, so he'll work hard to build himself back up to get back onto it again. So yeah, he will. He'll do as he's told, for sure.
So, enjoy your holiday, and I will see you in November.
Thank you.
Okay.
Thank you.
You're welcome. He's got good strength coming back in his hand, and from what he's saying, the sensation's improving as well. So yeah, he should be back to his usual activities quite soon, hopefully.
back on the medical ward. The big day is finally here for Davy and Nurse Lewis.
So today marks the end of Davy's chemotherapy treatment. So what we do is have a little celebration, and we everyone gets together and Davy will ring a bell to signify the end of his treatment. It's a nice moment, but also sad as well.
Davy, for being a very big and brave boy throughout all your treatment. Should we present for you? And there's a special present for you and Mummy to keep.
It's a really nice moment. It's quite an emotional moment as well because it's a big relief for the family, so there can be a few tears.
Are you ready? Let's see how much noise you can make.
Fist bump.
Give Lewis a cuddle then.
No, he won't give me a cuddle. It was good, yeah. It was nice to see that mark the end of the treatment. John?
How was the bell ringing?
It was good, yeah. David did a good job, eh? Where's he going? He's running away.
Over the next 4 weeks, Davy will have scans, tests and biopsies to make sure he's well enough to be discharged from hospital. And although he's nearing the end of his treatment, he'll make sure the staff won't forget him anytime soon, particularly oncology specialist Nurse Dot.
That's it, revenge!
Oh, what did he do today?
Did you put him up to that?
Me.
Just photo you two together.
Oh, dear.
No, I have to run there. Thanks.
Such a sofa.
I know.